In this video we will discuss about what are the possible mechanisms or what are the possibilities of secondary primary malignancy after CAR T cell therapies, and these are not been completely evaluated, or these mechanisms are not been finalized. They are just speculations based on the post-treatment CAR T cells data that they have got, and data that are presented here is based on the median value of those 2 years after CAR T cell treatments patients, and what are the mechanisms is also shown here in brief. First we will talk about this T cell lymphoma formations. In this case the 1000 CAR T cells are being transduced to the patients, and here what they have seen is that these T cells in which the CAR gene is inserted into the viral vector, and then it has been transduced or transgene injections occurs, and in that case the transgene positive T cells lymphoma they could be formed because of the random insertions inside these viral vectors, or insertion mutagenesis, or you can say that mutagenesis occurs during this whole process. The transgene negative T cell lymphoma, so these cases occurs around 0.5 per 1000 patients who are affected with CAR T cells based on the data that they have got so far. So in that case what will happen, these homeopathic stem cells will, when they undergo these differentiations or chip progressions, it will form a chip clone, and this chip clone will lead to this lymphoid progenitor, which will then undergo the differentiations, and first it will differentiate towards the B cells and then into the B negative T cells lymphoma, and this because of some of the malignant transformations might lead to the formation of this transgene negative T cells lymphoma. And so those who are not malignant will cause this CAR T cell treatment helps in the diagnosis, and those where the malignant transformations occurs will leads to this T cells lymphoma formations that will cause a side effect. Other one is shown to this in terms of the solid tumors, how it will affect the secondary primary malignancies can occur in the solid tumors. The solid tumors, first one is this non-melanoma skin cancer, and these cases are around 10 to 15 per 1000 CAR T cells patients, and here the longer lifespans has been observed for the patients who are affected with CAR T cells, as these CAR T cells will help in the maintaining the solid tumors within limit, and because of, and we know that for the CAR T cell treatment their patients need to go through the immunodeficiencies phase. So the speculations is that because of the acquired immunodeficiencies, patient might generate some of the secondary primary malignancies, or the secondary primary malignancies might be occurred because of the age the patient has become, or because of the older age patient has acquired, and these are the tipping scales. So if the patients undergo more immunodeficiencies conditions, then chances of malignant cells are higher, and this is how the balance needs to be made between malignant cells and the intact immunosurveillance. So if immunosurveillance is good, then they will have less efficient CAR T cells, and the malignant cells are also less, and the vice versa. Second one is this secondary myeloid malignancy. In this case the myeloid malignancy has been observed in the 25 patients who are per 1000 patients who are affected with CAR T cells. So it is also based on this differentiation where wild type homeopathic stem cells are taken and they are chipped into this homeopathic stem cells will undergo these chip progressions, and then it will have this fluorescence or cytochrome activities that will or we can say that some of the cells will be taken and the CAR T cells has been introduced in those cells, and those CAR T cells are again being transduced into this populations, that is homeopathic stem cells, and then myoblast might and in this process, after the CAR T cells has been transduced, then some of the mutations might cause at this stage that will lead to the formation of myoblast, and that will cause inflammations and diseases like overt leukemia. And this is also being seen in the patients who are going through these immunodeficiencies, and also in the patients uh, also in the older patients who has a higher age. So this is some of the, like, in vague form, it is not that clear, but this is based on the data that they have got so far, the some of the speculations of where this secondary primary malignancy occurs of the CAR T cells therapy. The data are also there, so we can know the percentage. If you need to understand more about their mechanisms or in detail how they come up to this theory, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.